Hello, this is Jacob Avila, and what I'm going to do today is tell you how to tell the difference between a retinal and a vitreous detachment. Your probe of choice for this examination is going to be the linear probe. Anything ocular, the linear probe is going to be your best bet. Now, the one piece of equipment that you're definitely going to need is you're going to need to use that tegaderm. The reason for this is that if you get any of that ultrasound jelly in the eye, it can actually be fairly painful. So if you do that, you're going to avoid making this procedure an unnecessarily painful procedure. So this is how you're going to actually do it. Now, you're going to take the tegaderm out, and that sticky end, you're going to place firstly over the medial aspect of the eye right there, and then kind of push and try to get most of the air bubbles out of there, because if you have any air in between that tegaderm and the skin, it's going to cause issues for you. And then after that, you just place a bunch of jelly over the eye, the more the better, and then you stick the probe on the eye. Here's an example of getting the correct view. It's very important to brace your hand on the patient's face, and you make sure to do that gently. This way you can be sure about how much pressure you're applying to the patient's eye. And again, you want this to not be a painful procedure, and if you push on the eye too hard, it's going to be a painful procedure. Also, it's pretty easy for the transducer to slide around if your hand isn't braced. So when you place a transducer on the patient's eye, this is what you should see in a normal patient. So what I'm going to do now is show you a super high-tech animation on the difference between a normal eye, one with a vitreous detachment, and one with a retinal detachment. This is a posterior chamber of the eye right here. Here's the anterior chamber. And this right here, this is going to be a hypoechoic structure behind the eye. This is the optic nerve, and a very important component of determining the difference between a vitreous and a retinal detachment, or if you don't have either. So if we look here, it looks like these lines are actually coming from the optic nerve. So see there and see there. And that's important because the retina itself is actually just an extension of that optic nerve. So if you see it coming out of that optic nerve, then it's very likely to be a retinal detachment. Now I want you to contrast that to this. So you've seen that same optic nerve here, and you're seeing a line extend just over that optic nerve, so not attached to it. So if you see this, the patient likely has a vitreous detachment. So here are a few real-world examples. Over here we have a normal eye with an optic nerve, and then over here, I want you to look at this line here. This is definitely an abnormal line, and we see this hypoechoic or dark structure right here. This is actually the optic nerve. I'm going to see this hyperechoic or white line actually looks like it's tethered to that optic nerve right about there, which would make it consistent with a retinal detachment. Here's another example of a retinal detachment. So normal eye over here, and then here we see this line right here. Now, if we saw this line by itself without seeing the optic nerve, we might assume that the patient has a vitreous detachment. And this is a great example as to why it's so important to get that optic nerve in the view as well. And we can see when we get the optic nerve in view right there, we see that that line is actually coming from the optic nerve, which would make this a retinal detachment. Here's an example of a vitreous detachment. Over here, we see the optic nerve right here. And if we look right here, we can see that this white line is separate from that optic nerve, not attached to the optic nerve. So this patient has a vitreous detachment. Now, unfortunately for this patient, also a retinal detachment right here. So you can see this hyperechoic line right here, and you can see that it is tethered to the optic nerve. So this patient, vitreous detachment and retinal detachment. Now to recap, remember, it's very important to use that tegaderm over the eye before you put the jelly on there. The reason why is that you don't want to get in that jelly inside the eye because it hurts. Remember that optic nerve is key. We have that optic nerve here and no hyperechoic lines anywhere. On this one right here, we have that optic nerve, and we see that this line is not tethered to that optic nerve, which would make this a vitreous detachment. Over here, we have that same optic nerve, but we can see that the lines are actually tethered to the optic nerve, which would make this a retinal detachment.